Good afternoon. My name is Kate Cole, and I'm with the communications team at Public Health Seattle and King County. Thanks to everyone for joining us for this press briefing with our health officer, Dr. Jeff Duchin. Dr. Duchin, I'll turn it to you.
Thank you, Kate, and thanks everyone for joining. It's good to be back with you. I've got a decent amount of information to share today. I'll review our recent epidemiology as well as spend a little more time than usual talking about vaccine breakthroughs, because I know this is an area of great interest. Touch briefly on back to in-person learning and leave time for questions as well. So to get started, like much of the country, we are experiencing a Delta-driven surge in COVID-19 with high levels of transmission in King County. Over the last 7 days, we've seen an average of almost 600 cases per day, which is a 72% increase in cases since I last spoke to you 3 weeks ago. Case rates remain highest in young adults and teens, followed by children and older adults at the bottom. Over the past 10 days, cases have plateaued in all age groups, and I hope we will turn the corner and see cases decrease from this high level over the coming weeks. But the trend and future course of the pandemic remains uncertain. Most cases continue to be among unvaccinated people, and I'll say more on that in a few minutes. Our 7-day incidence rate from August 18th is 180 per 100,000, which is up almost tenfold from 19 per 100,000 in late June. This is approximately 3 times as many cases as we saw at the peak of our outbreak last summer. Now, as you have all heard, hospitals in King County and across the state are at their highest occupancy rates and their fullest point since the pandemic began. Our healthcare workers are stressed and stretched thin. It's especially frustrating for them to see so many preventable, serious illnesses among unvaccinated people. In King County, 11% of acute care beds and 21% of ICU beds are occupied by COVID patients, levels of hospitalization that we haven't seen since December of 2020. Over the past 7 days, 164 King County residents were hospitalized for COVID-19. And this represents 1 King County resident hospitalized each hour, 24 hours a day, and has been stable compared to last week. This number of hospitalizations is 4 to 5 times higher than the 30 to 40 hospitalizations per week we were experiencing in late June. And compared with the surges earlier in the outbreak, the risk for hospitalization is lower for older adults, but comparable or higher for young and middle-aged adults. In the last 2 weeks, nearly 37% of those hospitalized for COVID-19 were 25 to 49 years old. And although COVID-19 hospitalization rates remain low for children and youth, we have seen a small increase in hospitalizations recently. In the last month, 18 hospitalizations were reported among King County cases between 0 and 17 years of age, 12 of which were within the past 2 weeks, compared to 6 hospitalizations within the previous 2 weeks. This number is similar to what we saw during the previous spring and winter surges. The rate of hospitalizations among cases between 0 and 17 years old remains very low, and there's no significant change in the rate. Remember, COVID-19 hospitalization rates lag a few weeks behind cases, and we may continue to see rises in hospitalizations for a few weeks, even once our case rates start to fall. Now, over the past 7 days, we've also seen an increase from 1 to 3 deaths per day. Over the last 2 months, we have reported 78 deaths due to COVID-19 among King County residents, and 2/3 of these deaths were among decedents 65 years and older, and almost 80% were not fully vaccinated. 4 out of 5 of deaths in the past 2 months were not fully vaccinated. Now, a greater proportion of deaths in the last 2 months are among younger residents under the age of 50 compared to the first 6 months of 2021. So in the past 2 months, we've had 13% of our deaths among younger residents below 50 years of age, compared to 4% during the first 6 months of 2021. Between January and June 2021, 82% of deaths were among decedents over 65 years of age, compared to 67% over 65 years of age in the last 2 months. So the average age of death is going down as our oldest adults are being protected through vaccination. And deaths among unvaccinated people are more likely to be in younger people. 39% of the deaths among unvaccinated people were lower than 65 years of age, compared to 13 of the deaths among fully vaccinated people being below 65 years of age. So we're getting very good protection from vaccinations. The number of hospitalized patients across the county is placing extreme stress on our healthcare system, and our hospitals are doing everything they can to continue to provide care for every patient. According to the Northwest Healthcare Response Network, our area intensive care units are full, and hospitals are stretching and extending staff and space and using every bed available. Because the hospital beds are very full, people may have longer wait times in emergency departments, ambulances may be experiencing delays, and our hospitals are working closely with one another throughout the Northwest Healthcare Response Network and the Washington Medical Coordination Center on a daily basis to support each other with surge and to transfer patients when possible. Our healthcare providers and our hospitals are asking the public to reduce their risk for hospitalization by avoiding physically risky activities and protecting themselves and others from COVID-19 by masking, avoiding crowds, and mostly getting vaccinated. Now, I want to spend some time talking in a bit of detail about what we're seeing locally with respect to COVID-19 risk for vaccinated compared to unvaccinated people and the issue of breakthrough cases. This is critical information to understand fully. The main message is that breakthrough cases do not mean vaccine failure. As more people are vaccinated, we hear more about COVID infections among vaccinated people, and that's normal and expected because no vaccine is 100% protective. And in a population where everyone is vaccinated, for example, the only cases would be among vaccinated people. So we should expect to hear about more breakthrough cases as more people are vaccinated. But just looking at the percent or the proportion of vaccinated people with COVID or the proportion with vaccinated people who are hospitalized or die is not really very useful because it tells us nothing about what's most important, about how the risk of getting COVID, of being hospitalized or dying, changes for vaccinated people compared to unvaccinated people. To determine this risk, we need to know how frequently these outcomes occur in vaccinated and unvaccinated groups. And that means we need to know the rates of disease in each group, not just the proportions. And when you look at rates, it's important to adjust or control for the age of the people that you're looking at. For example, older adults are both more likely to be vaccinated than younger people and more likely to have underlying health conditions that may decrease the protection they get from vaccination and increase their risk for being hospitalized or dying if they get COVID. So comparing all hospitalizations among vaccinated and unvaccinated would make it look like vaccine is less effective than it really is, because unvaccinated people are, in general, younger and healthier than vaccinated people. In order to compare most accurately, we should compare vaccinated and unvaccinated people of similar ages. This is called adjusting for age. Now, I mentioned earlier that most of our cases, hospitalizations, and deaths continue to be among people who are not fully vaccinated. So let's look at the numbers. For the past 30 days through the 25th of August, here are the percents, or the percentages, or proportions that are widely reported but tell us the incomplete story. 85% of COVID-related hospitalizations and 73% of deaths were not fully vaccinated, and 69% of all COVID cases are not fully vaccinated. Now, this tells us that vaccinations are good, that they're working, but it doesn't tell us how effectively the vaccines are reducing our risk for COVID-19. So we can look at the data now based on rates of disease and see how it changes when we take age into account. For example, if we don't adjust for age, during this time, compared to fully vaccinated residents, those who are not fully vaccinated were 4 times more likely to test positive for COVID-19, were 9 times more likely to be hospitalized for COVID-19, and were 4 times more likely to die due to COVID-19 related illness. So even without adjusting for age, the unvaccinated seem to be at significantly higher risk for getting infected, hospitalized, or dying from COVID-19. However, to get a more accurate result, when we adjust for age, compared to fully vaccinated residents, people who are not fully vaccinated are 6 times more likely to test positive for COVID-19, 37 times more likely to be hospitalized for COVID-19, and 67 times more likely to die due to COVID-19 related illness. Let me repeat this because this is the best way of looking at the data, and this gives us the most accurate assessment of the benefit of vaccination. Compared to fully vaccinated residents, people who are not fully vaccinated are 6 times more likely to test positive for COVID-19, 37 times more likely to be hospitalized for COVID-19, and 67 times more likely to die due to COVID-19 related illness. So these age-adjusted numbers provide a more accurate picture of the high level of protection that vaccination provides. And here's another important way to look at how well these vaccines are working, the change in risk over time. I'm going to ask Kate to show us 2 graphs as I describe them so you can see visually what's happening. Okay, so this slide shows us the rates of COVID-19 disease. The age-adjusted cases of people who are not fully vaccinated increased from 7 cases per 100,000 at the beginning of July to 77 per 100,000 on August 17th. And this is an increase of 70 new cases per 100,000 people among the not fully vaccinated. During the same period, the rate among the fully vaccinated increased from 1 case per 100,000 to 10 per 100,000, an increase of 9 new cases per 100,000. So you can clearly see the major benefit of vaccination in preventing the large increase in cases during the surge. Now, the second slide shows us that, second slide, yes, great. Among not fully vaccinated individuals, age-adjusted hospitalizations increased from 1 per 100,000 to 7 per 100,000, compared to an increase of 4 1,000 daily hospitalizations per 100,000 to 0.2 of 1 hospitalization per 100,000 among fully vaccinated people. So the rate among fully vaccinated was so low, 0.04 daily per 100,000 initially to 0.2 per 100,000 among fully vaccinated at the end of the period, compared to an increase from 1 to 7 daily hospitalizations per 100,000 for the unvaccinated. So I think these 2 graphics really visually communicate how beneficial our vaccinations are in preventing both cases and hospitalizations. Thanks for showing those, Kate. Another way of looking at this is among our 1.5 million fully vaccinated residents, about 0.4% have had a positive test following vaccination. About 1/100th of 1% have been hospitalized for COVID-19, and about 2/1000th of 1% have died due to COVID-19. So the bottom line here is clearly that COVID-19 vaccines, which are primarily intended to prevent serious infections, hospitalizations, and death, are working. These vaccines reduce the risk that a vaccinated person will catch and transmit COVID-19 and provide tremendous protection against severe infections, hospitalizations, and death. But you need to get vaccinated for them to work. Now, as you all know, Delta is responsible for almost all of our sequence cases in the most recent 14-day period. Delta virus is more contagious. People spread it more quickly after exposure, and they carry virus for longer periods if they're unvaccinated. Delta virus spreads easily through the air. Up to 3/4 of cases spread before symptoms develop. That is critical. And symptoms the disease starts to be spread 1 to 2 days before someone develops symptoms. And this is why both vaccines and other layers of protection are needed at this time, especially for unvaccinated people and for those at high risk and for high-risk settings. Now, on Monday, our statewide order requiring masks in indoor public spaces went into effect, and that's regardless of vaccination status. This is an easy step we can all take to add an important extra layer of protection. It helps protect people who aren't vaccinated, like children under 12, as well as people who have compromised immune systems and older adults who might not have underlying health conditions, placing them at increased risk. Universal masking in indoor public spaces is a reliable way to ensure everyone stays safer in settings where it's impractical to verify every individual's vaccination status. And this is a state requirement, and it's important for businesses, workplaces, and other public locations to adhere to the governor's order. Now, just to underline the importance of mask wearing, I'll share with you that in their current report, the University of Washington's IHME, Institute for Health Metrics and Evaluation, finds that if universal masking is implemented next week, it will prevent between 1,600 and 2,500 deaths in Washington state by December 1st. I want to pivot and just briefly touch on back to school. Many students are returning to in-person learning in the coming days and weeks. And with the more contagious Delta variant widespread, return to in-person learning is going to be more challenging than ever. And a layered approach with multiple precautions is critical to reduce the risk of COVID transmission. We all recognize the tremendous benefits of in-person learning, and I want to recognize and thank the many teachers, school and child care center staff, and families who are working to create a safer in-person learning environment for our children and staff. First and foremost, the layered approach starts with vaccination. Everyone 12 and older should get vaccinated. Students who are 12 and older, school faculty, staff, and family members. Community members as well can do their part in protecting our children by getting vaccinated. We encourage all teachers and school staff to be vaccinated as soon as possible because it takes 2 weeks after the last dose to be fully protected. We're certainly hopeful that a vaccine may be available for children between 5 and 11 years of age by the end of the year and for younger children after that, but that is not established at this point. For all children, it's important to remember to get up to date on other routine childhood vaccinations before the first day of school, because these vaccines are required, and students who are missing vaccines may not be able to participate in school activities. And remember, students can get required vaccinations at no cost to them from their healthcare provider, from their school-based health center, or at various free clinics and events. And you can find more information at kingcounty.gov/find-a-clinic. Students should also remember to stay home from school if anyone in their home tests positive for COVID-19 or they've been otherwise exposed to COVID-19, or if the student tests positive, or if the student has mild symptoms that could be COVID-19. Now, the State Department of Health has developed requirements and guidance for schools and childcare to help reduce the risk of COVID-19 transmission. And these include maintaining a physical distance of 3 feet or more whenever possible, and maximizing that distance during meals and high-risk activities such as singing or sports. And the state reminds us that when it's not possible to maintain at least 3 feet of physical distance in classrooms, it is essential that schools layer additional prevention strategies to reduce the risk of disease transmission. And this includes things like improving ventilation, and that is critical. And I'll speak more about that in a minute. And conducting screening testing of students and staff to identify infections early on before spread occurs. All staff and students aged 5 years and older are required to wear a mask and stay as distant as possible, and people should wear the best quality and best fitting mask that is available to them. Schools are required to provide access to COVID-19 testing when students have been exposed to COVID-19 or are experiencing symptoms, and schools are required to regularly test unvaccinated students and staff who participate in indoor sports. Schools are also encouraged to regularly test other students, particularly those participating in high-risk activities like group singing. Now, ventilation is critical for preventing COVID transmission in indoor settings. Schools should have consulted with a professional engineer or a heating, ventilation, and air conditioning specialist to determine the best way to maximize ventilation and filtration of the air in each area of the school. It's important to know that portable, high-efficiency HEPA air cleaners can supplement ventilation. All of these layers taken together will reduce, but not eliminate, the risk for the spread of COVID-19. and we will continue to work closely with schools on safety plans, and we're prioritizing additional resources to help with this work. We'll be working with schools to also rapidly respond to outbreaks that may occur and to investigate and take whatever steps are necessary to prevent or contain the outbreak. More information about guidance for schools and how we investigate outbreaks is available at kingcounty.gov/COVID/K12-toolkit. I also want to take this opportunity to remind people again about other COVID-19 risk and prevention measures, because in addition to getting vaccinated, which is the most important single factor in reducing risk, your risk for COVID-19 depends on a number of other things, including the nature and duration of exposure you have to infected people, your underlying health status, your behaviors, and the characteristics of the virus. And this is true for both vaccinated and unvaccinated people, because vaccines can't give 100% protection. Exposure means risk increases with crowding and proximity to infected people, with longer duration of contact, with being indoors rather than outdoors, with poor indoor ventilation, with not using a face mask or using a low quality or poorly fitting face mask. And underlying health conditions also affect risk, especially severe immunocompromised, but also certain other conditions in older age. Behaviors that increase the risk include loud talking, shouting, singing, aerobic exercise, and close or prolonged contact. COVID-19 variants that are more contagious, like the Delta virus, or cause more severe illness, like the Delta virus, or evade protection from vaccines, not like the Delta virus, thankfully, can also increase our risk. And it's important to understand that risk is additive. The more risk you take, the more likely that you will be infected. So to lower your risk of COVID-19, do fewer risky things, minimize high-risk exposures, settings, and behaviors, and of course, get vaccinated. Now, on that topic of vaccination, I would like to report some good news that we now have over 70%. As a matter of fact, 72% of all King County residents have initiated the vaccine series, and 2/3 of all King County residents have completed their vaccination series. This is undoubtedly providing us with a significant level of protection during the current Delta surge. Among all residents 12 and older who are eligible for vaccination, 83% have initiated the vaccination series, which is outstanding, and 77% have completed it. Over the last 7-day period, 10,400 King County residents received their first vaccination, which is a 14% increase from our low point on July 20th. We continue to have disparities, however, by geography, race, and ethnicity, but there's good news in that people are being vaccinated in these groups at a higher rate, and these gaps are narrowing. As of this week, 70% of people aged 12 and older from all race and ethnic groups have received at least one dose of vaccination. We've also reached 70% or more vaccinated among people 12 and older in all of our major geographic sections of the county. The east part of the county with 87% vaccinated, North County 83%, Seattle 79%, and South County at 70% vaccinated. We're also seeing vaccination coverage among our youth that are aged 12 to 17 years of age that are very encouraging, with 71% having one or more vaccinations and 63% complete. And these rates are similar for the 12 to 15-year-olds and 16 to 17-year-olds. However, the rates do vary again by geography, with lower rates in South King County compared to the North and the Northeast County. And these maps are available at our online immunization website. So we're anticipating an increase in vaccine demand in the coming weeks as people respond to vaccine requirements and anticipation that more people will become eligible for booster shots, and more people get motivated to be vaccinated based on the spread of the Delta virus and the increasing evidence of the effectiveness of vaccines in preventing serious illness, hospitalization, and death, as well as infections and spread. So we're planning to scale up and meet the demand, and we anticipate some partnership sites will be reopening or expanding in the coming weeks, and we'll provide more information on that as we have it. Also want to remind everyone that COVID testing is a vital strategy for limiting the spread of the virus in our community. and anyone with signs or symptoms of COVID-19 should be tested as early as possible, regardless of vaccination status, and this means even mild symptoms. And if you're vaccinated or not vaccinated, if you're around someone who has a suspected or confirmed case of COVID-19, you should get tested 3 to 5 days after exposure, even if you don't have symptoms. And if you test negative, continue to monitor yourself for symptoms for 14 days and get tested if symptoms develop, and isolate yourself right away. I think at this point we should stop, and I welcome a discussion and take some questions from you before we finish up.
Excellent. Thanks so much, Dr. Duchin. As a reminder for media, you can use the raise your hand function in Zoom to ask a question. And first question will be from Steve McCarran.
Hi, Doctor. Thanks for the question. I have two for you today. With regards to some of the trends that you're seeing, are you optimistic about what you're seeing with the trends in regards to cases and hospitalizations, with the plateau that you're seeing, at least based on the case numbers? And then the second question is, how much more we talked about the huge burden that's been placed on hospitals in King County recently. How much more of a burden do you think those hospitals will take on with the capacity of hospitals in other areas of the state being stretched so thin, and there's obviously a reliance on the level of care that we have here locally?
Yeah, thanks for the question, Steve. Am I optimistic? I'm cautiously optimistic. I believe that this disease, this COVID-19, is highly unpredictable. One thing that I think we can depend on is that the more of us that are vaccinated, the lesser it will impact us, at least the current virus, the Delta strain. I can't tell you with certainty, whether our plateau in cases is going to be sustained. It's certainly at a high level, an unacceptably high level of disease transmission currently. So the status quo is not a good place for us to be. The hospitals are very stressed, and too many people are becoming sick, hospitalized, and dying. So I think that what we need to see is a decrease in cases. I believe that can happen. I would not be surprised if we saw a decrease in cases over the next weeks through September, but I'm very worried about what may happen when our children come back to school for in-person learning, and of the holidays, again, the gathering around the holidays that are upcoming. There's a Labor Day holiday, and then we have Thanksgiving and Christmas again. People come indoors. In the winter, we had a winter surge last year. So I'm very concerned that we may see, progressive surges, peaks, and then declines, and then further surges. And to the extent that we protect ourselves through vaccination, I think the extent of these future surges will be limited as long as our viruses remain susceptible to the vaccines as they have been to date. But I do think it's important for us all to understand the uncertainty around, what we may experience once children come back to school. And this really emphasizes the need to take all possible protective measures in the school setting to create the safest possible environment, and to be prepared, if necessary, to go back to remote learning if we find that there's too much transmission happening in the school setting. We need to give it our best shot right up front, because this disease acts quickly, it moves fast, and it's rather unforgiving. So, am I optimistic? Cautiously optimistic, although I don't think this is going to be the end of COVID-19 for us, even if we get over this hump. We've got future opportunities for people to gather, and until more of us are vaccinated, we won't be in the clear enough from my perspective to fully relax. With respect to the hospitals, they're very stressed now, but they're getting by. They have not had to resort to what's called crisis care, where they ration healthcare resources, but that would be a potential step that we're seeing other hospitals take in other parts of the country who've been overwhelmed. Now, those communities have much less immunization, much lower immunization coverage than we do. We should feel proud and gratified, and should be very pleased with the large number of people in our county who have been vaccinated, and which is providing us with a significant level of protection against overwhelming impacts that some of the other parts of our country are seeing. So I do think that, if we continue to vaccinate adults, if boosters are necessary, that we get them out to people in a timely way to continue that protection of the highest risk adults. And if we are able to expand vaccination to younger ages and get those kids vaccinated, we will progressively be in a better and better place, and our healthcare system will be in a better place. But I still think we're in a very tenuous situation right now with the healthcare system. There's still potential for outbreaks to exacerbate and for things to get worse. And remember, even after the cases come down, hospitalizations and deaths can continue to rise for several weeks. So we have a period of uncertainty, and I think each week I'll be able to give you a better picture of where we're headed.
Thank you. Next question is from Jessamine McIntyre.
Thank you, Dr. Duchin. Good afternoon, and thank you, Kate, as well. I wanted to follow up on what you had to say about the education system in schools. I haven't had a chance to go through the entire toolkit yet, but I was wondering if you could give some guidance when it comes to quarantine. For instance, we're hearing from Kent that if 2 kids test positive, the whole class goes into a 10-day quarantine. And what would it take? So is that accurate? Do schools have autonomy when it comes to making those decisions, or is there a directive overall for every school to follow? And what would it take for an entire school to have to quarantine and shut down?
Well, there are guidelines, and I don't have them in front of me either. I do believe that there is some flexibility. I mean, there's interpretation and who's been exposed. And I think that's where we work with the schools to see, what is actually the nature of exposure. And though it's the exposed group that has to quarantine. So, whether that would be a whole classroom or part of a classroom or a whole school really depends on, what the specific circumstances and the nature of exposure in that setting. And that's why we have our team available to work with the schools and try and figure these things out quite quickly so that we can get those people who are exposed out of the school environment and decrease the risk that they would unintentionally spread COVID to others. So I don't know if I can answer your question about the 2 persons, without having a little more context. And I'd be happy to review those guidelines and talk with you if there's some area that's not clear to you in the future. What was the second part? Sorry.
What you think it would take for, or when you would recommend an entire school quarantining and shutting down?
Yeah, again, so, who needs to quarantine really depends on who we determine has been exposed. So that it's very situation dependent. There's not like a cookie cutter, one size fits all approach. Now, whether a school shuts down and goes back to remote learning depends on a few things. It depends on whether they can manage with the number of staff that they have and whether they feel like they're meeting their educational mission with the number of students that are able to come in. So for example, if lots of students become exposed and have to quarantine repeatedly, or worse, lots of students become ill and are needing to miss school and resulting in other exposures in the school and making it very impractical for the school to carry on, or we just determine that the number of kids getting infected is unacceptable. And that's a decision that would be made in consultation with the community, the parents, the school, and so on. Then schools would be advised to return to remote learning. I think all schools need to be prepared for that. We don't know what to expect with Delta. We certainly need to give it our best shot. And I think there's reason to believe that we can manage an acceptable level of disease transmission and carry on the educational mission with the maximum amount of distancing, with meticulous attention to improving ventilation, with good quality masks and adherence to masking, and of course with vaccination of eligible students and staff. But if that doesn't work, we need to be prepared to pivot back to remote learning.
Thank you. This is a good segue to a question we received from the community on Facebook. The question is there a community infection rate or metric that would return schools to remote or hybrid learning?
There's no, there has not been. Like earlier in the pandemic, the state had issued specific community transmission metrics that correlated with various levels of in-person education. Those are no longer being used.
Thank you. Next question is from Dahlia Bazaz.
Thank you, Kate. Good afternoon, Dr. Duchin. You might be aware of this already, but the CFO of a school district in King County recently posted from his personal Facebook account some criticisms of the indoor mask mandate and vaccine order. He said they should be a choice, and he argued that we should just let the virus run its course and become endemic. He also stated during a public meeting that 3 feet of distance is, quote, so last year. What are the consequences of such statements, and what does it mean to you that there are government decision makers here in King County who are vocal about these beliefs?
Well, first of all, everyone's entitled to their opinion, but that's a very, I think, misinformed opinion and a dangerous opinion to share with others who might not be able to evaluate it critically. We know that letting this virus run its course will result in an unacceptable number of people becoming ill, developing long COVID, being hospitalized and dying. And we have a very safe and effective way to prevent that. So why someone would advise that rather than vaccination is hard to understand. In addition, we know that masks work. And I just shared with you information that from the Institute for Health Metrics and Evaluation that says, thousands of deaths could be prevented just in Washington state alone if we went to universal mask use, high compliance with universal mask use in the next week between now and December 1st. So both vaccines and mask mandates are known to be very effective and among our most effective tools, along with improving ventilation and decreasing COVID-19 transmission. Now, we know there's been plenty of misinformation about every aspect of this outbreak from the get-go. And I hope that people, use their good common sense. I presented some very useful data about how effective our vaccines are. And I'm sure that everyone agrees that although it's individual, I respect individual rights and autonomy, people do have their rights. You might think you have the right to drive drunk because you want to get in your car and you're feeling good and you've been out partying and that's your right. But I don't think that's really correct. We need to also think of the rights of other people on the road. And with respect to COVID-19, people may think they have the right to expose others to a disease that can land them in the hospital or potentially cause them a long-term health disability or potentially kill them. And I think we need to remember that the people who want to protect their health also have rights.
Thank you. Next question is from Omari Salisbury.
Hello, good afternoon. My question is here, like in our community, we're seeing a lot of misinformation, and it appears to really be very organized misinformation. So I had a 2-part question is, are you guys finding that, you're fighting more and more of an uphill battle about misinformation around the vaccine and COVID? And then also when people, this spike that's at the hospital, this going on, is anybody asking people like, okay, why didn't you get vaccinated? And if you are, like, what are some of the responses you're getting? Like, people just didn't have the time, or they were against it, or anything like that?
Yeah, thank you, Omari. So, the problem with vaccine and COVID misinformation is a big one. It's like whack-a-mole. You find one source, you correct it, and others just pop up. It is a business. Some people are making money on this, selling information, books, false treatments, and so on. And it's also a strategy used by foreign governments who want to destabilize our community and create dissent and undermine, the effectiveness of our country's COVID-19 response. And there are others who just simply are honestly misled and sharing information that's incorrect. There's a variety of different sources of information, different motivations for sharing it, and different reasons why you see it. It is a huge challenge because, in general, the public health system and the healthcare providers, don't have the time and resources to counter and address each source of misinformation. We're busy taking care of sick people and trying to prevent illnesses, and we don't have, the limitless resources that these sources of misinformation seem to have, and of course, the ability for even a small source to have their false information widely amplified on social media is incredibly hard to counter. But nonetheless, there are some excellent sources of reliable information that are available, including, our local department and our federal agencies, the CDC and University of Washington, academic institutions here locally. You can find great information on the Washington State Department of Health website. But still, your point is well taken, that there's just so many strategies that people are using to spread falsehoods and misinformation that it's challenging. I am not aware of any local studies that ask about why people did not get vaccinated, but there's plenty of information out in the media that have involves interviews with people who haven't been vaccinated. There's been a whole series of cases of people from other states recently that have shown those who previously were against vaccination ending up in the ICU on a respirator with a breathing tube, and then communicating to their friends, their loved ones, their families, their audiences, how wrong they were to please, get vaccinated, that, they made a big mistake. There have been lots of stories like that. Some of the reasons people don't get vaccinated is because they have legitimate questions about vaccine safety, which we can answer. Now this vaccine has been fully licensed by the FDA. It meets the same safety and effectiveness standards as every other routine vaccine. It is incredibly safe. And when you look at the number of deaths, hundreds of thousands of deaths, hospitalizations, long COVID, and the damage that this disease has done, there's no contest between the benefit that you get from vaccination and the minimal risk of harm that is in contrast to the significant and deadly effects of this disease. So, there's also issues around access to vaccine, which we have tried to eliminate as much as possible by making vaccine in our community widely available. And I think it is now at pharmacies, healthcare providers, in our King County sites and our partner sites. But there are issues still that people have. Certain people may just have trouble accessing, and we have teams available to try and address those issues. And of course, there are the people who have ideological reasons for not getting vaccinated, which is very tragic and one of the most difficult to counter. Initially, our former president was not promoting vaccination. He has since come around and asked people to please get vaccinated. But there were still many other elected officials and political ideologues who are undermining the vaccination efforts for reasons that are beyond me. So it is a broad range of reasons why people don't get vaccinated. And we're certainly very all ears and open to hearing from you and others in the community about things you think we can do to help address concerns that people have, to help them make the decisions that will keep them healthy, keep their children healthy, keep our community healthy, and allow them to take advantage of the amazing benefits that I showed earlier in preventing COVID-19 hospitalization and death through vaccination.
Thank you. Next question is from Eilish O'Neill.
Thanks for taking our questions. I'm wondering if King County is already working on plans for rapid and equitable vaccine distribution to children under 12 once a vaccine is authorized for that age group, and if so, what those plans entail.
Yeah, I can tell you, yes, we are working on plans for distribution to younger children. We're also partnering very closely with our healthcare providers because most of our routine vaccines are administered through the healthcare system. So we're working with our local community and in the Washington chapter of the American Academy of Pediatrics of Family Practice to make sure that vaccines will be available equitably. With respect to community-based access, if that's what you're referring to, I can't provide details on that, but we can definitely get back to you.
Great. Next question is from Northwest Asian Weekly. They weren't able to attend, but wrote in with a question. They're curious your thoughts on the Lambda variant, Dr. Duchin, and what you predict locally for that.
Yes, so COVID-19 virus continues to mutate, and sometimes it mutates into a virus that's called a variant of concern, which means that it has potential human health impacts. The Lambda variant is a variant that's common in South and Central Latin America, South America right now, and it appears to be spreading very effectively there, causing significant amounts of severe disease. It's not clear what the course of that variant will be elsewhere, whether it will take hold in other communities like up farther north, North America or other continents, because whether or not a particular variant is successful depends on how well it can compete with the other prevalent variants. And that means how well it transmits compared to Delta and how much protection people who have been vaccinated and who have been infected with Delta may have against Lambda. So it's definitely something to keep our eye on. It's definitely a concerning variant, but it's really hard at this point to predict whether or to what extent it may become an issue here in North America.
Thank you. And now we have another question from community on Facebook. There's a lot of discussion about outdoor lunches for students in schools. One person says, right now, restaurants are requiring unvaccinated customers to eat outdoors. With that in mind, are conversations happening about mandating outdoor lunches at schools, especially elementary schools where students are unvaccinated?
I agree that outdoors is safer than indoors, and whenever possible, when students are unmasked, they should be outdoors, or if that's absolutely not possible, they should be in an indoor location, adequately distanced with appropriate ventilation measures in place, or filtration, air filtration, to maximally reduce that risk. As far as mandates, the state has and the governor and the state developed the requirements for schools, and I'm not aware that they're considering a mandate for outdoor lunch or eating. So I don't think so.
Thank
but
you.
It is a recommendation.
Thank you. And then last question, again from community on Facebook. Any recommendations for timing of flu shots this fall? Should people be getting them as soon as possible or waiting for any reason?
I believe that the current guidelines are about to be released by CDC. They usually have a section on timing. It may already be up. I haven't checked recently. But usually, for most people, we say getting vaccinated late summer, early fall is ideal. For some of the older folks where the vaccine protection may drop a little bit more quickly, the timing is a little more critical. But right now, personally, I usually get vaccinated, late September to mid-October. I know many people get vaccinated before then, which is fine because you don't want to miss an opportunity to be vaccinated. But it really depends on your access and how finally you can time it. If you want to try and time it, as close to the onset of the season as possible, but not too close so that you get influenza before your vaccine kicks in. Usually our season takes off November. So getting vaccinated in September, is a good time for most people. But there's not going to be anything different this year as compared to previous years with respect to the timings that I'm aware of.
Thank you, Dr. Duchin. Let's hear. It looks like we've got one final question from media, and then we'll turn it to you, Dr. Duchin, for final remarks. So, Monica, go ahead.
Hi, thank you so much for taking questions. I'm Monica Velez with the Seattle Times. I've been hearing a lot from concerned parents when it comes to lunch, just a lot of anxiety because that's the chunk of time where students are going to be maskless, sometimes indoors. So what advice do you have to parents who might be worried about keeping their children safe during lunch?
Yeah, well, first of all, again, outdoors is preferable whenever possible. If it's going to be indoors, the things that we'd want to do is maximize the distance between children. So try and get to that 6-foot distance whenever possible. to ensure that that is a well-ventilated space and that there's additional supplemental filtration, if possible, in place. So understanding from the school, what is the status of the indoor air quality? And that's true not only in the lunch room, but also in the classrooms. Parents should be able to understand, what is the status of the air quality. And there should be 5 to 6 air exchanges per hour, ideally in those rooms to reduce the risk optimally. And that can be achieved through ventilation or filtration, or a combination of ventilation and portable air filters. So there's distancing, there's ventilation, and then masking, giving the child the highest quality mask possible that fits as snugly as possible and that the child can tolerate wearing. And there's plenty of information on the web about the various types of masks that children can wear. N95s are usually not a good option for children. They're not approved. They don't fit children well, and that's probably, maybe for some of the oldest high school students, that's an option, but for most children, no. But there are KN95s, KF95s. There's the cloth mask that can be made snug fitting, and so on. So looking at the best quality mask that your child can possibly wear is another thing that you can do to help reduce the risk. So I think those are the key things. Outdoors when possible, distancing, improving indoor air quality through ventilation and filtration, the quality of the mask. And if there's an option for the child to eat quickly and get out, and another place to go that's considered to be safer, or put the mask back on, quickly afterwards, I think that would be a potential option as well.
Thank you. That's it for questions. So any final remarks from you, Dr. Duchin?
Yeah, thanks, Kate. Thanks everyone for joining us. It's good to be back with you. The Greek letter delta is the symbol for change. And it's an appropriate designation for the most challenging COVID-19 variant that has yet emerged. The Delta virus has changed the trajectory of the pandemic, challenging us locally, nationally, and globally. And as the virus changes and improves its ability to infect us and make us sicker, our response and strategies to protect ourselves must change and improve as well. Thankfully, we have tools that work readily available, especially vaccination, and also ventilation, quality and well-fitting masks, and distancing. Over time, the COVID-19 pandemic will diminish as more people are either safely protected through vaccination or remain unvaccinated and become infected with the risk for serious illness, hospitalization, long COVID, and death. But the path to a more normal life will likely continue to be a bit unpredictable and likely a bit bumpy for a while longer, with intermittent ups and downs. Vaccination is the best way to reduce the risk for COVID-19, including severe COVID-19, and to controlling this pandemic. And I encourage everyone who is eligible to be vaccinated now, and everyone to wear a well-made and well-fit face mask or respirator when in indoor public spaces and crowded outdoor spaces, and pay attention to improving ventilation and indoor air quality, limit high-risk activities, and take other COVID-19 prevention steps as needed to reduce your risk and our community's risk until COVID-19 has been more reliably controlled and the threat of serious stress on our healthcare and our health is behind us. So thank you, and I look forward to speaking with you again in a couple of weeks.
Thank you so much, Dr. Duchin, and thank you to everyone who joined us today. As a reminder, you can follow along with public health's work at publichealthinsider.com and find us on social media at KC Pub Health. Thanks so much and have a good weekend.